for today is gut health, and we'll be talking about 5 things you can do to improve your digestive health. Some conflicts of interest and a disclaimer before we get started. I do work for the CHI as well as the Canadian College of Naturopathic Medicine. And just so that everyone is aware, the webinar doesn't provide any medical advice. So it is intended for your informational purposes only, doesn't substitute professional medical advice or diagnoses or treatment. And any information presented in this talk might not be applicable to everyone, so it's a good thing to note. So we'll proceed. So an overview of what we will be talking about today. I'll cover what happens during digestion, so we'll go through the digestive process. I'll talk about a few common digestive concerns like heartburn and constipation, and then we'll go over together 5 things that you can do to improve your digestion. So first off, what happens during digestion? Parts of our digestive system are almost constantly working in unison. Right now, as you're listening to this talk, I'm guessing your body might be digesting your dinner in your stomach, and maybe it's also digesting your lunch in your intestines. And maybe even right now you're sipping on some warm tea. So digestion is happening in the mouth as well. Understanding what happens during digestion does help us better understand digestive complaints and conditions and how to treat them. As you've probably heard before, most people say that digestion begins in the mouth, and this is only partly true, actually. So digestion actually begins at the sight and smell of food. So before food even enters the mouth, the digestive process has already begun. If you can think about the smell of a freshly baked chocolate chip cookie, or the sight of a warm, cheesy pizza with your Nona's homemade tomato sauce, for any of you that are Italian, chances are in these settings, your mouth is already watering. We don't always feel our mouth water, but when it does, there is saliva being released. And that does begin the digestive process. So once saliva is secreted in the mouth and throat, it does contain enzymes which start the breakdown of carbohydrates. And in addition to that chemical digestive process that happens, we also get mechanical digestion, which happens when our teeth are breaking down the food we're eating even further. People who experience dry mouth don't produce enough saliva, and this can lead to things like difficulty chewing and difficulty swallowing. When we do swallow our food, it enters our esophagus, which pushes food downward into our stomach by making these kind of wave-like muscle contractions. And those muscle contractions are called peristalsis. So the pressure of the food, that as it makes its way to the end of the esophagus, actually signals our lower esophageal sphincter to relax, and this allows food to pass from the esophagus into the stomach. In our stomach, we have both chemical and mechanical digestion happening. So along with those muscular contractions that happen in the stomach also releases acids and enzyme-filled gastric juices, which help break down our food even more. The natural pH of a healthy stomach is quite acidic, which is about 1.5 to 3. Hours later, after digestion is happening in the stomach, a valve called the pylorus opens up and allows food to move from the stomach into the first part of our small intestine. So in the small intestine, food is exposed to more digestive juices coming from our liver, our gallbladder, and our pancreas. So the pancreas produces digestive enzymes which help break down proteins, carbohydrates, and fats. The gallbladder stores bile. Bile is produced in the liver, which helps with the breakdown of fat as well. And once fatty food enters the duodenum, which is that first part of the small intestine there, the gallbladder releases bile into the small intestine through bile ducts. Our small intestine also contains villi, which are tiny projections in the small intestine, and these help to increase absorption and help transfer nutrients from the small intestine into our bloodstream, which is then shared with other tissues in the body. So the small intestine is comprised of 3 different parts. As we mentioned, the duodenum already, which is that first part, And then we also have the jejunum and the ileum. As our food mixes with bile and those pancreatic juices, it is broken down into smaller and smaller molecules, which allows for easier absorption of nutrients. And again, in the small intestine, same as what happens in the esophagus, we get a process called peristalsis happening, which helps move food through the small intestine. By the time our food reaches the ileum, almost all the nutrients that our body wanted to absorb are now in our body and no longer in the actual stool itself. So after exiting the ileum, which was that last part of the small intestine there, food passes through the ileocecal valve and empties into the large intestine. The large intestine also has three parts to it. We have the ascending colon here, which comes up the right side of your body, the transverse colon going across the abdomen, and then the descending colon going down the left side of our body. Our large intestine is where we absorb a lot of water and salts, and food is converted into a more solid form before it's excreted.
Dynamic.
So as stool enters the rectum, there are nerves there that sense it expanding, and this signals to us that we need to use the washroom. So in learning about these processes that happen in our digestive system, we can better understand how digestive concerns happen and how to treat them. So we'll move into the second part, which is some common digestive concerns. And if you are sitting down and you have the chat function there, feel free to type in any common digestive concerns you've heard of. We will be covering a few of them today. So the first one we'll talk about is heartburn. Heartburn is also sometimes called acid reflux, and in chronic settings, it's also called gastroesophageal reflux disease, otherwise known as GERD. Heartburn can be a temporary symptom that we might get, for example, after eating something acidic, such as lemons, or it can be a bit more chronic. So where some people experience heartburn daily, it can lead to things like GERD, as I mentioned, both stomach and duodenal ulcers and gastritis. And some common triggers for heartburn are things like those citrus fruits like lemon, oranges, and we also have alcohol being a very common concern and trigger for heartburn, as well as smoking. People who actually quit smoking and cease smoking, they find that heartburn improves generally within a year after stopping. Next, we'll talk about constipation. Constipation is a very common concern that we see, or I see in practice. And again, this one can be a temporary symptom. So for example, maybe after a long weekend where you've had some different foods, like more fast food and foods that you don't normally eat, maybe you weren't drinking as much water and maybe alcohol was a bit higher on the intake than usual, you might notice some temporary constipation the weekend following. There is also chronic constipation, otherwise known as functional constipation. So this is where people experience it much more regularly. And constipation can also be a symptom of some other conditions, such as hypothyroidism or IBS type C, which is IBS that sides more on the constipation side. And later on in the presentation, we will talk about a few things that you can do for constipation. So let's go over IBS as well. So as I mentioned, IBS can have some different types to it. So we do have constipation type, but we also have diarrhea type and a mixed type as well. IBS, otherwise known as irritable bowel syndrome, is a very common disorder, primarily impacting the large intestine. It is motility-based, meaning that it mostly happens because of the contractions and the muscles along the intestines. It's not so much any physical damage, so we can't kind of do a scope and see irritable bowel syndrome in the intestine. Some common symptoms of IBS include abdominal pain, bloating, gas, as well as changes in bowel movements. So again, diarrhea, constipation, or a mixture of the two. IBS is also a diagnosis of exclusion, which basically means that we have to kind of rule out some other digestive concerns before we can diagnose IBS. Some reasonings behind that are that a lot of the symptoms of IBS overlap with other conditions. So some of the diagnoses that we might want to rule out before diagnosing IBS are things like celiac disease, inflammatory bowel disease, as well as things like functional constipation or things like hypothyroidism. Lastly, we'll talk about inflammatory bowel disease, which again is something that I have myself. So inflammatory bowel disease is an umbrella term that actually covers 3 different conditions. So there is Crohn's disease, then there is ulcerative colitis, and there is a third called indeterminate colitis, which isn't as popular or well known, but indeterminate colitis is kind of a mix of the 2. IBD is a chronic condition. There is no cure for it, and it is relapsing remitting, meaning that there are flare-ups of IBD that you can have, and other times when it can go into remission. IBD is a condition of chronic inflammation. So we can do things like a scope to diagnose IBD, which would be done with a medical doctor. And they can see inflammatory bowel disease in the intestine. For Crohn's disease, it is the disease can act or impact the entire gastrointestinal tract. Whereas with ulcerative colitis, IBD actually only impacts the intestines. Some common symptoms, again, kind of similar to IBS, we have abdominal pain there. Abdominal pain is usually a lot more severe in IBD. We also have blood or mucus in the stool, and there is a lot of weight loss, loss of appetite, and fatigue associated with IBD. In naturopathic medicine, for all of these concerns, we do work alongside conventional medicine to help support people with digestive conditions like these. So without further ado, we'll move into 5 things that you can do to help improve your digestive health. The first one we'll talk about is increasing fiber intake. So what we eat is actually one of the fastest ways that we can impact our gut microbiome. For those of you who don't know, the gut microbiome is basically a very diverse and large number of bacteria in the intestines. We do have a microbiome on our skin as well as our gut, but the gut microbiome can impact a lot of different factors outside of just digestion, such as our mental health too. So I'm curious what you think of when someone says fiber. We have a lot of vegetables probably coming to mind, including root vegetables and leafy greens. Grains are a really great source of fiber. We have wheat bran, oats, and oatmeal. A lot of nuts and seeds contain high amounts of fiber. And then we also have legumes like lentils and beans being a great source. So the big question, how much fiber do we actually have to eat in a day to support our gut microbiome? On the left here, we have some recommendations for females, and on the right for males. These images are taken from Canada's Digestive Health Foundation. And I'm just highlighting a couple of those here because the general population and probably those attending today are between 19 and 50 and 50 plus. And in those categories, we do recommend for females 25 grams a day, and for males about 38 grams a day. We have a couple special populations there as well. So in pregnancy, a hormone called progesterone actually relaxes muscles in the GI tract, and this can slow down digestion in pregnancy. In addition to that, as we age, the body becomes less effective at absorbing fiber. Constipation can increase because of this, as well as our risk for colorectal cancer and diverticulosis as well. So maintaining a high fiber intake is important throughout age. Let's talk about some benefits to increasing fiber intake. First, we have weight management. Diets high in fiber are actually associated with lower BMI and better ability to manage weight. We also get better management of our cholesterol levels with fiber intake. We get regular bowel movements with both insoluble and soluble fiber. Fiber decreases our risk of some types of cancer. It helps stabilize our blood sugar levels as well. And blood sugar levels are important because if we are having a meal that is maybe a bit higher in sugar or simple carbs, pairing that meal with fiber, and having a high fiber intake with it actually changes the way that our body absorbs that sugar. So instead of having a spike in blood sugar afterwards, we get a bit of a slower introduction into the bloodstream. And lastly, a high fiber diet lowers our risk of developing hemorrhoids, diverticular disease, and it helps us manage pre-existing conditions. This is a bit of a complicated looking diagram for you here, but what I want you to look at are these SCFAs, which are short chain fatty acids. So when dietary fiber and resistant starch are fermented, the main metabolites we get in the intestines are those short chain fatty acids, and they are produced by the gut microbiota in the large intestine. Short chain fatty acids, we have three main ones, which are acetate, propionate, and butyrate, and they help modulate many processes in the gastrointestinal tract, which include maintaining our intestinal barrier, which is that intestinal epithelium here. It also helps manage mucus production. So mucus is something that actually lines our entire digestive tract, as weird as that might be to think about. The short chain fatty acids also help manage inflammatory processes, such as activating and recruiting leukocytes. And as you can see here, it does have an impact on all of these target tissues, such as the pancreas, our smooth muscle, our fats, leukocytes, liver, and blood cells. And it has a further down kind of trickle effect on the immune response and metabolism. And there are three main conditions listed at the bottom here that we want to impact with short chain fatty acids. So on a practical level, what does getting 25 to 35 grams of fiber in the day look like? This is a bit of an example here of what you could have throughout your day in order to get 39 grams of fiber, which is actually more than what we even recommend for males. So for breakfast, we have half a cup of oatmeal. Maybe you're putting some walnuts, some flax seeds, some chia seeds, and berries on top, and you can put some honey on there to sweeten it. And with half a cup of oatmeal, in addition to about a tablespoon of flax seeds and a tablespoon of those chia seeds, we have 14 grams of fiber in that breakfast, which is already over half of the intake for females. At lunch, maybe we have a spinach salad. Maybe there are some other vegetables in there, and we aim for about 2 cups of that salad. And we put that salad on a bed of quinoa, which is about 1 cup. And then maybe after lunch, we have a snack, being yogurt with half a cup of blueberries, and there's about 15 grams of sugar in that meal together. Lastly, for dinner, maybe we opt for some grilled fish, a side salad with shredded carrots, and half a cup of lentils. And there is about 10 grams or more in that meal right there. The next thing we can do to improve our digestive health is focus on some of our drinks that we consume and beverages throughout the day. So there are 3 types of drinks that we'll talk about. First being sugary drinks, second being alcohol, and the last one, which probably doesn't come as a surprise, is water. Starting with sugary drinks. So a 2021 systematic review on the role of diet and lifestyle in early onset colorectal cancer actually found that the consumption of sugary drinks, among other things, increases our risk of developing early onset colorectal cancer. And early onset is defined as colorectal cancer before the age of 50. And just so you're aware, for future slides, I did shorten colorectal cancer to CRC, so you'll see that in later slides too. Other things that sugary drinks can contribute to are weight gain, fluctuations in blood glucose, an increased risk of high blood pressure or hypertension, metabolic diseases, and a lower microbial diversity, which basically means a lower diversity of bacteria in the gut. Next, we have alcohol consumption. Again, alcohol consumption does impact our risks for developing early onset colorectal cancer. It can also increase our chance of weight gain. It aggravates digestive concerns such as IBS and IBD. So a lot of people with IBD find that alcohol can trigger a flare-up or some symptoms. It also increases our risk of certain cancers such as head and neck cancer, esophageal cancer, liver, breast, and CRC. And it also increases the risk of developing second primary cancers. In addition to those things, it does increase our risk of metabolic diseases such as diabetes, and chronic alcohol intake can cause dysbiosis in the gut. Dysbiosis meaning a negative impact on the gut microbiome. This diagram here I know looks relatively complicated, but I want you to focus on just this part right here, highlighted in red. So basically, this study looked at some protective and negative effects of diet in early onset colorectal cancer and found that sugary drinks was a risk factor for developing early onset colorectal cancer. So if you look at the line on the left there where there's the number 1, the line is above number 1, meaning that it did have a significant effect. Lastly, we'll talk about our water intake. So going back to our issue of constipation, constipation is actually a symptom of dehydration because when we are dehydrated, our intestines are working extra hard to pull water from feces. So if you ensure that your body is properly hydrated, less water will be withdrawn from the colon. It's not necessarily something that can completely improve constipation, but definitely helps. And the general goal is to aim for about 6 to 8 glasses of water per day. And that number does increase actually with exercise. So generally with exercise, we want to consume even more water. Some people do best actually at about 2 liters or 3 per day. The third one we'll talk about is sleep. So we all know probably the recommended 7 to 9 hours of sleep per night for adequate energy and tissue repair, but we often don't hear as much around sleep when it pertains to digestion. So let's talk about how sleep can impact digestion. Firstly, it impacts our appetite. So when we have shorter sleep or fragmented sleep, we do get changes in ghrelin and leptin. Ghrelin is our hunger hormone, and levels tend to rise in response to sleep deprivation, while leptin, the fullness hormone, levels end up tending to decline with chronic sleeplessness. Because of these changes, difficulty sleeping can lead to overeating because we feel more hungry than usual. It can also contribute to weight gain because of that. And it also changes the types of foods that we crave, which can consequently lead to gut dysbiosis, which is an imbalance of that gut microbiota. Changes in sleep can also worsen outcomes for digestive health conditions. So for example, with inflammatory bowel disease, poor sleep is actually linked to worse disease activity, and it is a predictor of both subclinical inflammation and a risk factor for relapse and poor digestive outcomes. It can also worsen inflammatory responses, and it has been linked to an increased risk of colorectal adenomas. So one study found that shorter sleep duration was associated with an increased risk of colorectal cancer, and this was seen with getting less than 6 hours of sleep per night. Interesting enough, probiotics may help improve sleep quality. A double-blind placebo-controlled study on 38 healthy volunteers were given a probiotic mixture of about 4 different strains for 6 weeks. And they actually found an improvement in sleep, as well as a reduction in depressive mood states, anger, and fatigue. And this was in healthy volunteers. So there is a lot of space for improving sleep, even for people who don't have digestive concerns. Here we have some resources for sleep. So there are some apps that are really great at helping people manage their sleep, as well as anxiety related to sleep. And I've listed a few of those apps there. I believe they are all free, maybe except for Aura and Headspace. I think there might be a charge for those ones. But Mindshift there is actually an app endorsed by Anxiety Canada, and there are a lot of great tools to use on there. Second, we have sleep hygiene. So sleep hygiene involves things like turning off your phone before bedtime, using a blue light filter, waking up and going to bed at the same time every day. Melatonin, generally we recommend more for jet lag and time changes. So it can really help people when you're traveling, adjust to any time changes. And especially, with the time change a couple of weeks ago, that would have been a great time to use melatonin. Another resource for sleep is bright light therapy. You might have heard of bright light therapy for seasonal affective disorder, but it can really help people feel more alert in the mornings, as well as improve stress and mood management. And on that note, let's talk about stress management. So this is the fourth thing that you can do to improve your digestive health. There is a link between our mind and our gut, and it is something we're still learning more and more about, and relatively new to the research world, but there are some clear links that have been established between the two. So digestive problems can cause things like anxiety and stress, and vice versa. Anxiety and depression can impact our digestion and cause symptoms like stomach pain, heartburn, and diarrhea. So first, let's learn about some ways that the brain and digestive tract are connected. And this is by no means an exhaustive list, but first we have the vagus nerve, which is part of our nervous system. Our vagus nerve connects the brain and our gut, allowing them to communicate. And actually 90% of the neurons in the vagus nerve are sending messages from the gut to the brain rather than from the brain to the gut. Next, we have our enteric nervous system, which is a whole network of nerve cells. There are like over 100 million of them, and these exist in our digestive tract. The ENS, or the enteric nervous system, is often referred to as the second brain just because of how many neurons it has and how much communication goes on there. Lastly, we have our gut microbiota, which I know we've mentioned a little bit about already, but it does communicate with our brain via neurotransmitters, which are chemical messengers. And like I said, in addition to these three things, there are many other ways that our brain and our digestive tract communicate, such as through the immune system and our endocrine system. So let's talk about what stress actually does to the gastrointestinal tract. It can cause things like stomach cramps and stomach pain, and this is due to some changes in digestive motility. So for example, with IBS, when we are stressed, it is a trigger for symptoms. And basically what happens is the muscles in our intestines and surrounding the intestines are contracting more than they need to, and this can cause stomach cramps and stomach pain. Stress can also increase the permeability of our intestines, which basically means things can get through the intestinal barrier, which aren't generally meant to, and this can lead to inflammation. Lastly, it also has a negative impact on our gut microbiome. So generally, when stress is high, we do see a reduced number of strains in the gut microbiome, and the type of strains changes as well. Unfortunately, if we want to improve our stress management and our mood, it's not as simple as just thinking positively. There are a lot of other things we have to focus on in order to really make a lasting impact. So some ways that we can manage stress: it is a very multifactorial approach. First, I'll go over a few mindfulness-based interventions. As we know in life, stress is inevitable, but we do have both eustress, which is positive stress, and distress, which is negative stress that happens throughout the day for all of us. And our coping systems aren't always able to meet the external demands that are placed on us. And this is usually when we experience an excessive amount of stress. And for that, we can look to things like psychotherapy. CBT, or cognitive behavioral therapy, is something quite well studied for stress management and mood. In addition to that, we have things like meditation and breathing techniques. For those of you who have never meditated before, I'm sure this sounds like something that's way out there, but meditation can be beneficial even after just a few minutes of implementing it. If you're considering starting meditation, I usually suggest starting around about 2 minutes a couple times a day and increasing from there. And then if we want something a bit more simple and ready to access, we can look at breathing techniques. So breathing techniques might be something like doing box breathing, or just taking 3 slow, deep breaths before doing something stressful in your day. From the digestive side, some interventions we can look at are things like probiotics. So probiotics have been used in human studies and demonstrated benefit on improving mood, mental well-being, decreasing depression scores, as well as decreasing stress. And in IBS specifically, probiotics seem to improve barrier function, decrease intestinal permeability, and also help with immune modulation. The second one we have there, as we talked about before, is increasing fiber intake. The third we have is melatonin. Melatonin can really have a positive impact on stress, even though people take it at nighttime for stress levels, sleep, it does also impact stress. And melatonin has actually been used in ulcerative colitis, which is one of the types of IBD, to prevent exacerbations caused by stress. The last thing we can do from a dietary perspective is really diversify the types of fruits and vegetables we eat. So there are actually studies as well comparing the gut microbiome and impacts on, just having the same fruits and vegetables every day, like an apple for breakfast and maybe carrots and celery as a snack in the evening, compared to people who have a lot more variety. So one of the kind of suggestions we usually say is to try a different fruit or vegetable every week and keep some things in rotation. The last thing we'll talk about to improve our digestive health is exercise. So naturally, I know you probably all have a good understanding about how physical activity gets our blood flow moving, and we know it can lead to strong muscles and strong bones and improved cognition, but it also has a great impact on digestive health. Let's go through a few of those things. So first one we have is reducing colorectal cancer risk. So studies actually suggest that physical activity might prevent up to 15% of colon cancers. And the benefits aren't just limited to preventing cancer. Patients with cancer and who have thrived after cancer can reduce their risk of mortality and of recurrence by up to 50% with exercise. Studies looking at exercise and quality of life show an improvement for both people with irritable bowel disease as well as inflammatory bowel disease. So I know when you have active stomach pain or you're in the middle of a flare-up, exercise is the last thing that you probably want to do, but it can be something as simple as going for a walk or taking 10 minutes of your day to do some jump squats and push-ups. The third way that exercise can improve digestion is through for constipation. Regular exercise can help encourage healthy bowel movements by getting blood flow going. And constipation is associated with a lack of physical activity in teenagers. So the more sedentary we are, the less movement and blood flow our digestive system gets. Fourth, it can help prevent gallstones. So exercise is thought to reduce bile stasis, which again, we've mentioned bile being in the pancreas there. It also lowers insulin and triglyceride levels. Lastly, exercise can actually improve the composition of our gut microbiome, meaning it can actually improve the types of bacteria and strains we have there. So let's talk a bit about some different forms of physical activity. And over the last decade or so, our understanding of how exercise impacts digestion and digestive conditions has vastly changed. There is a lot of research with yoga, specifically for IBS. Yoga was studied to reduce IBS severity, bowel symptoms, anxiety, as well as improving quality of life. In addition to that, there are many benefits of exercise for preventing disease, improving quality of life, and managing pre-existing conditions. So another good example is with inflammatory bowel disease. Exercise can actually help manage inflammatory levels, support the immune system, improve stress levels and quality of life, and help to prevent colorectal cancer. So people with IBD have a higher chance of developing colon cancer, and regular exercise can help reduce that risk. Here we have a bit of a schematic that was posted in the Exercise and Sport Science Review, and it's basically depicting some different ways that exercise can impact our digestive system, as well as our brain, adipose and muscle tissue, and possibly some other organs. So how does exercise improve our digestion, and how much do we actually need to do in order to alter our gut microbiome? So changes have actually been seen in research after about 6 to 8 weeks of exercise training, which is just 1.5 to 2 months. So you don't really have to get into exercise for very long to notice a positive impact in the gut microbiome. And there are several studies that have been done comparing, for example, professional rugby players to lean sedentary people. And they find within the rugby player groups, there is a higher abundance of many different types of bacteria. In another study, they looked at women who were active for at least 3 hours a week and compared them to sedentary controls again, and found an increase in 3 different types of strains of bacteria. For 2 of those strains actually help produce butyrate, which I've mentioned before or earlier on is a type of short chain fatty acid. And the 3rd strain is actually associated with more lean BMI, so body mass index, and it actually improved metabolic health as well. This here is taken from the Canadian Physical Activity Guidelines, and it goes over what they consider to be a healthy 24 hours. So we have physical activity on the far left here, and the recommendation is 150 minutes per week of moderate to vigorous activity. Moderate to vigorous activity is basically anything that gets your heart rate up and elevates your body temperature. It might be something like running, skipping, doing tennis, or swimming. Light physical activity is movement that doesn't result in as much sweating or shortness of breath, and that might be something like slow walking, stretching, or gardening. In addition to those 150 minutes, they also recommend doing strength training. So I know a lot of emphasis sometimes is placed on cardio, but we really do need that resistance exercise in addition to that. This here are some resources that I've listed for you for exercise. Again, we have a few apps here. The first one is the Nike Training app. It is free to download, and you can really customize the types of physical activity that you want to do in the Nike Training app. You can filter it for how much time you want to commit to exercise, what type of muscle groups you want to work on, as well as how much equipment you have at home, which I found to be especially important for people during the pandemic without access to gyms. The second one I have there is an app called Down Dog. This app was actually free for teachers and students throughout the pandemic. It offers some customizable yoga routines, some HIIT workouts, meditations, running, bar classes, and prenatal yoga. The last one I have here is called Join. Join is actually great for encouraging movement from a place of body neutrality. For those of you who aren't familiar with body neutrality, it basically really just encourages people to accept the body that they're in and not be in a space of body negativity. So Join is a great app that really promotes physical activity for every type of body out there. And I recommend it more for people with eating disorders. A couple other resources, we have Cancer Care Ontario's exercise guide, as well as a template that they've provided, which I'll show you on the next slide. And the last one that I think is very underused is friends and family. So there are a lot of studies looking at exercise and how to get people exercising from, doing little to no activity to getting more regular with it. And the involvement of other people in your life, telling someone that you are starting an exercise program, and even joining the gym or going for runs with someone else really helps adhere to exercise. This here is a tool developed by Cancer Care Ontario to help you track your exercise goals. So they have a couple weeks listed here, and you can track the minutes that you did that day, type of activity you did, as well as the intensity of it. So in summary, we've covered what happens during digestion, a few common digestive concerns, and 5 things that you can do to help improve your digestion, which have been number 1, increasing daily fiber intake to about 25 to 35 grams per day, depending on your sex. Second one, decreasing alcohol intake and sugary drinks. You can opt for those de-alcoholized beverages and increased water intake. Third was to develop good sleep hygiene. Fourth, to implement daily practices to help manage stress and mood. And lastly, to aim for 150 minutes of exercise per week, including a couple of days of strength training. So I just wanted to say thank you to everyone who attended tonight. We got a really great turnout. If any of you are looking for more information on digestive health or want more specific help with digestive concerns, you can book a free 15-minute meet and greet with me, or an initial visit through the Centre for Health Innovation. I have listed their website there, their phone number, and we are, both myself and the CHI are on Instagram if you'd like to follow us there.